If you live in Hawaii, you probably know the feeling. Trying to find a new family doctor or even just getting an appointment can feel, well, almost impossible. It's a huge problem, and a new piece of legislation is trying to tackle it head on. So let's get into it. This is the Primary Care Protection Act. And look, this isn't just a feeling people have, it's a very real, documented crisis. The Hawaii Provider Shortage Task Force has been digging into the data, and what they found is the driving force behind this bill. They're basically sounding the alarm, saying our healthcare system is under some serious strain. And here's the number that really puts it all into perspective. According to the University of Hawaii, our state is short 768 full-time healthcare providers. I mean, that is a massive gap between the care we all need and the doctors who are actually there to provide it. So how did we get here? Well, it's a bunch of problems that have all snowballed into what's basically a full-blown healthcare emergency. Let's break down exactly what this new bill is trying to fix. So out of that huge shortage of 768 providers, the single biggest hole is in primary care. We're talking about your family doctors, your pediatricians, the first person you see. We are short 152 of these essential doctors, and that hits families across all the islands directly. And you have to ask why. Well, it's not just that we aren't attracting new doctors. We're actually losing the ones we have. This quote comes straight from the bill itself, and it says they're leaving because of unsustainable financial pressures. And that really gets to the heart of the problem. The cost of just running a doctor's office in Hawaii, rent, staff, supplies, it's gone through the roof, just like everything else here. But the payments that doctors get from insurance companies, they've stayed pretty much flat. It's simple math. Their practices are becoming financially impossible to keep open. Okay, so faced with this crisis, the bill puts forward a really powerful and direct solution. It's being called the 12% solution, and it is the big idea at the very center of this whole thing. So here's the core idea. The bill would literally require insurance companies to spend at least 12% of their entire medical budget directly on primary care. It's a fundamental shift, trying to push the money back toward that foundational, everyday health care. To put it another way, for every single dollar an insurance company spends on healthcare, whether it's on surgery or specialists or anything else, at least 12 cents of that dollar has to go straight to a primary care provider. It's a really clear, simple requirement. And they've designed the bill to be pretty much airtight. The money has to go directly to the doctors giving the care. It can't be siphoned off by some middleman, it can't be lowered by some complicated performance score, and it can't be hidden in some corporate wellness program. The whole point is getting real money to the front lines. But this act is about more than just the money. It's also trying to fix the broken, frustrating administrative processes that just drain doctors' time and energy. It's really about rewriting the insurance rulebook to protect doctors and, in turn, their patients. Okay, so a key target here is a practice called downcoding. Here's an example. A doctor provides a really comprehensive exam and bills for it, but the insurer just changes the billing code to a simple checkup, which pays the doctor less. This happens all the time without any clear medical reason, and this bill aims to stop it. Under these new rules, the burden of proof is going to shift completely to the insurer. If they want to change a claim, they can't just let an algorithm do it. They have to provide clear clinical evidence from the patient's own record and justify it in writing to the doctor within 5 days. The bill also goes after prior authorizations. That super frustrating process where your doctor needs to get permission from the insurance company before they can even give you a test or a treatment. Instead of waiting for weeks, which can happen now, urgent care approvals would have to happen within 24 hours and standard requests within 48 hours. Big difference. It also includes this really smart idea called gold carding. It's just common sense, really. If a doctor consistently gets their requests approved over 90% of the time, it means they're trusted to make good decisions. So they get a gold card and become exempt from that whole prior authorization process for a full year. Okay, so new rules are great, but they're only as good as the enforcement, right? How does this act make sure that insurance companies actually follow these new rules? Let's look at the accountability part. Well, the bill definitely has teeth. It sets up clear financial penalties. It starts at $5,000 per violation, goes up to $10,000 for repeat offenses, and for systemic, ongoing problems, the fines can go all the way up to $500,000 a year. And this is really important. That fine money doesn't just disappear into some government black hole.
It all gets deposited into a brand new primary care stabilization fund. And that fund will be used to reinvest right back into the system, to support rural clinics, to help keep doctors here, and to improve telehealth. The Act also recognizes that, hey, healthcare access is not the same on every island. So it includes specific protections for rural areas, it requires insurers to cover medically necessary inter-island travel, and, this is a big one, it mandates that telehealth visits get paid at the exact same rate as in-person visits. All right, so if this bill does become law, when would all of these changes actually happen? It's not all at once. The rollout is designed to be phased in so everyone has time to adapt. So, as soon as the bill is approved, state agencies can start writing all the detailed rules. Then, on July 1st, 2025, those major protections for doctors, like the downcoding ban and the faster prior authorizations, they kick in. And then finally, on January 1st, 2026, the big one, that 12% spending requirement, officially goes into effect. So you can see it's a really comprehensive and ambitious plan. It's trying to rewrite the financial and administrative rules that have basically strained Hawaii's healthcare system to the breaking point. And it leaves us with a huge final question. Is this the blueprint to finally fix primary care? Not just here in Hawaii, but maybe for the rest of the country too.